what are the best ways to ensure client retention? And then also attracting new clients. This is one that we get asked very often, because new clients means our books are full and we're making money, and it makes our lives a lot easier. It's certainly an interesting profession and job to have. It's not one where you turn up and get paid a salary. You need to have the clients coming in that keep those books there. So what keeps them rebooked, and then what do we do to attract new clients coming in as well? Shaun, fill me in. I can't hear you.
My mistake. Got to learn to turn the mute off. I was just apologising, saying I'm going to put my hand up for every question. So sorry, guys. This one, I really wanted to answer, because I think, again, a little bit like our last one, we need a different question. So how do we improve client retention? Well, then how do you make anybody like you is really the question. If you want someone to stay your friend, provide them value in the relationship. If you want to maintain a connection with a relative, provide value in the relationship. Same thing in business. It's just about being more valuable than the next person, and not to hold on to a patient, but so that they respect you and trust you enough to want to come back when they need you. I actually am against the idea of trying to retain patients. I don't think we should try to keep them ours. I think as a good clinician, our job is to get them out of our life and us out of their life as fast as humanly possible. In an appropriate way. So we need to give them the outcomes that they're chasing. We need to give them the understanding, the education that they need, and the tools and the understanding to move forward without us. The human body is not designed to have people like us to maintain itself. This is my philosophy, and I know not everyone will agree. That's okay. So I don't think we should try to keep our patients in our lives, nor should they need to or want to keep us in their lives. But if we deliver on value against anyone else that they might go and see, then the solution will be obvious for them, that whenever they have a problem, will be that solution for them. So it's about being better than the next person at what you do, being smarter, being better skilled, and delivering more value, caring more than the next person, I think is the trick.
Yeah, I think a huge part of this, and I always bring this back to business in any perspective, is value. We can't continue to ask. We need to provide value. And it's more about what value do you give to anything that you kind of deliver within business. Everyone loves this topic. Let me go to Erin. Erin, fill me in. What is your perspective on this?
Yeah, I think this is such an interesting one. I agree. And look, I've worked in a bunch of different clinics, and I've worked for that person that's like, okay, let me train you in how you get these repeat clients, and let me train you how you book this person every 4 weeks and they come, religiously and that sort of thing. And then I've worked in clinics where it's like, good luck, hope you get some. So I think it is such a tricky thing, but I agree. It comes back to building a rapport with someone, and I feel that it's really about putting a lot of time and energy into having your practitioner hat on, and working really hard to be, and it's going to be the wrong word, but that people pleaser of, okay, what do you need from me? Do you need me to listen to you? Do you need me to give you really good advice? What type of practitioner do I need to be for you? Obviously within reason. And that builds that relationship. I think sometimes when we find when a new client kind of comes in to see us and they've got that really fabulous, juicy presentation, they've got that peripheral neuropathy that we all love, and you're like, great, I can do this, and this for you, and you just get so excited and you're trying to throw 20 things at them. Sometimes that can be overwhelming for people. You need to build that rapport slowly. So I think that's certainly one of the ways that I find is really good to work on client retention. The other thing I find is it's about getting confident with your language and practicing your language. And I could give you a spiel. I could give you the words that I use, but you have to use something that works for you. And if you're using someone else's spiel and someone else's words, it never comes off right. So the best thing that I think you can do is put yourself into that awful, uncomfortable position where you're like, right, today I'm going to try talking to my client about rebooking this way. And then, it works, it doesn't work, you do it again, you try something different. And for me, that's how I built my confidence in it. And it really is a confidence thing. If you believe that patient needs to see you again, then tell them. They've come to you for help and for advice and for support. So it doesn't have to be about, I'm telling them to come back because I want them to come back. So
I need my retention high.
Yeah. I need my 90% rebooking rate. No. If you think that their presentation warrants follow-up, tell them. And then you lay it out for them, and it's their choice. They can choose to rebook, or they can choose not to. And I find sometimes that is has far better results for people. If you say, hey, look, I really think that I need to see you again. Best case scenario, I see you next week. But if that doesn't work for you, book yourself in within the next couple of weeks. It doesn't matter, we'll work with it. And it gives people a clear indication of what they should do, but it still gives them that delicious free will that we all love.
I really think of that as when we go to the GP, and if you go in, we go to see them for their advice and their specialty that they see. And they tell us to come back based on their medical advice. They say, if you've got cancer, I need to see you back in XYZ. They don't go, cool, I diagnosed you with cancer. Thanks for coming. Do whatever you like. It's kind of like we attend these for the advice of people, and it's the same with us. And if we just give genuine advice to what our knowledge knows, I think you'll find the rest really sorts itself out quite quickly. Steph, did you have to add to us as well?
Yeah, just a few little points, again, based off what everyone else has said. So I think, and again, building relationships is a massive one with your clients. If they trust you and they know the service that they're going to get from you and how that will set them up to succeed, they will want to come back to you. So I think if they can see that vision that you've got for them as well, so whether that's through your practice or whether that's through communicating that with them, that this is our end goal, this is where I want to get you to, and if it aligns with their values, then obviously they're going to want to come back to achieve that. I think if you can envision yourself as the practitioner who can fix your client, so to speak, to the point where they, as Shaun said, they don't need you, versus that person that needs your client, where your client feels like they need to come back to you every 2 weeks for the rest of their life because that's what fixes them. So again, that mentality and picking the language with your clients that suits that client's mental state, I suppose. I know we always get asked questions around how frequently do I need to rebook my client? And again, Shaun will probably say, well, we need to find another question for that. So why do we need to rebook our clients, for one? Do we need to rebook them? And if so, what is our purpose with rebooking? And I think having flexibility with that treatment plan and not having rigidity and going, okay, we need to see you every week for the next 3 months. Let's go, okay, let's see you next week just to see how you are. And then we can base that follow-up treatment off next week's treatment. So you're working progressively with your client. It's not like a set in stone program, because again, does that become more of a business model, making money model, rather than being in it for what we really want to be in it for? So I suppose figuring out for all of us as practitioners, what's your purpose with your business? Yes, we all need to make money and we need that client retention from that, but are we better off focusing on ourselves as a practitioner? And in turn, that's going to get us that business model that we want potentially. So they're my few points.
It's that same thing of rapport and coming back. Bo, to add to that as well.
1 minute. I think really being upfront with them from the get-go as well. Look, based on your presenting condition, signs and symptoms, and your goals, I'd like to see you in, 4 times over the next 2 weeks. Right? Being very upfront and direct from there. at 2 weeks, I'd like to have a review session with you. Does that sound okay with you? And then we can establish the next steps from there. But at least there's a plan in place and they've got some clarity as far as direction. Okay, we've got 4 sessions. We should expect to see some good changes in that time. If not, we reevaluate, we reassess, and potentially take a different path. But when we look at the effects of manual therapy, we often get those better effects in the short term. All right. Rather than saying, so, oh, well, let's see how you're going. Let's come back when you're feeling it. Or, it's having that confidence from the start and just saying, look, based on my professional experience, based on your goals and your expectations about getting back to sport or whatever that may be, this is what I propose. Does that sound like that aligns with your goals and preferences? And we have a bit of an agreement from there. So it's sort of that verbal contract that you've got from the start. And you could say, well, look, typically this might take between 12 to 24 weeks. But to get there, we do need some progressive increases in treatment and exercise. And ideally, we're going to have some review sessions along the way. Because if we say, 2 weeks and then we'll see where we're at, hopefully it's fixed by then. Well, it's having those realistic expectations that it could take 6 months, 12 months. That doesn't mean that I need to see you every single week. When we review in 2 weeks, 4 weeks, 6 weeks, ideally what I'd like to see is that we can start to space these sessions out so you can start to self-manage. So I think that's a useful way to do it. And obviously everyone's going to be different. But at least there's a bit of a treatment plan that's been verbalized to the patient.
Yeah, absolutely. And I think that matches what Gracia has told to us into the chat here as well, that that really clear communication, what are their expectations? Because sometimes, as Erin says, like we get super excited about conditions and we go on this like bandwagon to get it finished, but the expectations of the client and what we want are very different things. And we haven't actually said to our client, well, cool, what do you want? Like, what do you want to achieve here? So sometimes setting those clear things and being very clear from the start that we have the same goals and this is the progression of the goals as well.